Hi, my name is Butchy, and I'm one of the general surgery residents here at Cooper.
Hi, I'm Dr. Goldenberg. I'm one of the trauma surgeons here at Cooper.
What do you see are the invisible barriers facing women in surgery today?
I really think the invisible barriers are things that we place on ourselves, like things that we're doing to ourselves mentally and physically as women surgeons that we're not even seeing. It might not even be the expectation that other people have of us, but it's really the expectation that we as a society of women have on ourselves and then on other women. So, we want to be perfect, role models. We want to be perfect teachers, perfect wives, perfect mothers, perfect, surgeons, clinicians, doctors. But then we also feel the need to somehow take on everybody else's perfection as well. So we're rounding for, another team, writing orders for another team. I don't know how many times you've done it. I've done it so many times, right? Yeah. Following up on things that are not even my responsibility. And I think those things really push the boundary of, how we exhaust ourselves and the barriers that we have on our own, like health and just, well-being in general.
Yeah, I feel like I see that everybody has comments on but what are her kids doing? What is she doing after work? Why does she have to leave so early? Those kind of comments that never happen for other colleagues. I think one of the barriers that have impacted me the most now that I'm in the final year of residency has been I'm stepping into leadership roles more often than I have in previous years. And it's been a big change from the typical approach to surgical leadership, which I think is very single party driven, very alpha, power hungry. I feel like I have more of a collaborative approach than most people, and it's a different way of running the teams than I think is typical for surgical practice. So that's been a shift in things for me.
I think, for such a long time, we as doctors, not only surgeons, have been taught to be like this stern, not human role model for everybody, right? Like this godly complex. And I think that needs to go away. I think in order to connect with our residents and with other physicians and our patients, we have to be more human. We have to have, deeper conversations about what people are struggling with, what they're thinking about outside of the job, what they're thinking about on the job, what's affecting them in terms of their performance, right? So how are you feeling? Ginny and I, we talk about concerts, we talk about relationships, we talk about kids, we talk about travel, right? And those things connect us and they help us bond when we take care of patients, right? Because I know what she's thinking and she knows what I'm thinking, and I know her mood and she knows my mood. So I think it's really important to as a female physician to be that way, not only for your residents but also for your patients, right? Get deep with them and figure out what they're thinking.
Yeah, I definitely see now our residency is primarily women, and I think that the culture is shifting, and it's very much because we're following the lead of people that are doing less crushing and more lifting.
Yeah,
yeah,
for sure.